Now, should everyone wear face masks in public to help prevent the spread of flu? 0207 862 2222. You won't believe this now. UK health chiefs have issued the advice to anyone experiencing symptoms of a cold, flu or even COVID. So crucially, I need to add, this isn't about lockdown 2. It's not about if you're healthy, protect yourself. It's about if you are sneezing and sniffling and coughing and just emitting viral spume and you have to go on a train, please wear a mask. Downing Street says, yes, that's exactly right. If you're feeling ill, you will stop this tidal wave of flu cases. The virus has left a record number of patients in hospital for the time of year. That reached an average of 1,700 every day in the last week of November. It's reported that a mutated strain of flu is circulating, which a lot of people may not have immunity to. So, Carol, face masks. At least let's start with people who are sick and coughing.
They don't work. Face masks don't work.
But it's not clearly, by definition, you can't cough the same distance. Try spitting with a face mask on.
I can see you've made your mind up where you stand on this debate.
Well, I haven't really.
However, they don't work, and there is evidence to show that they don't work. And especially in this country in 2020, when the Respiratory Threats Advisory Group said they don't work, SAGE, the Scientific Advisory and Emergency Group, said they don't work. The reason we were all mandated to wear masks during COVID, says Matt Hancock in his book, was that Dominic Cummings was obsessed with them, and he made everyone wear them.
I never know where we got to. We're going to talk to GP in a second.
They do not stop.
You don't think they stop germs?
Well, it's not me.
They must do.
It's not me who's saying that. I've just read it. Two big groups. No, you're not listening. The Respiratory Threats and Advisory Group and the SAGE Committee said they do not work.
Right, well, why didn't I catch anything during COVID, apart from COVID itself? For about a year, we had no coughs and colds, right? And that's because we were all avoiding spreading.
The UK had the biggest per capita death mortality rate with COVID than any other European country.
Yes, but that's not what I'm saying. What I'm saying is we managed to reduce the amount of virus going around our society because of the mitigations we took, and one of them was masks.
The scientists are saying
masks don't work.
The scientists are saying that is not the case.
I'm confused now. What do you think? Right? Can you give us some science?
So I can actually give you some science. So Chris Smith, the virologist, I listened to him last night.
Love him.
And he's an amazing communicator. And he spoke about a few key things. So one is that this particular strain of flu, as you alluded there, has come over early. That's what's caused the early hospitalisations. Therefore, we're surprised by it simply due to the time of the year. But crucially, the different strain means that it hasn't circulated in the UK with much effectiveness for a couple of years. So we are not as immunised to it.
Right.
So to me, the problem, even if masks were to work, what we're doing is we're reducing our exposure to it, which will reduce our immunisation. So we're delaying the inevitable.
I see.
So for me, I think it's actually important that we just meet head on. I was on a train coming down here. There was a guy coughing and spluttering.
And I did next to
him. Basically next to him. And I thought, this isn't brilliant. But at the same time, it's life.
I do buy that. I hear you on that. I do agree that our immune systems need to be in the exercise yard, and COVID reduced their sort of vigilance. But can I just get a GP in quickly, because it's possible that we could at some point hear from an expert. No, were you going to put your head in your hands?
No, I was taking my glasses off.
Sorry, I thought you heard GP and you put your head in your hands.
No,
okay, Dr. Natalie Rout, hello.
Hello.
Hello, good morning, everybody.
So, morning.
Look, obviously we've got a very basic issue here we can't agree on, firstly, which is whether masks work.
Well, we agree.
Well, hang on. Wait a minute. That's not science.
So
you
they
and
do
Radzi
not
agreeing.
100% reduce complete transmission, but they do reduce it depending on who's wearing them, how they're wearing them, and what sort of mask they're wearing them. And this you will also remember from the pandemic. So another reminder, this is not the pandemic. No one is going into a lockdown. This is a recommendation for those people who are unwell with symptoms to wear a mask if they're going to be going out in public, because that can and is scientifically proven to reduce the spread of that person's germs who is infected to others.
Well, it sounds like common sense to me. If you put something across your mouth, I'm looking at my friend Carol here. If you put something across your mouth and you cough, your cough is going to go less far, Carol.
Well, Yes, but
Clearly.
and I'm sure the doctor would agree with me. Have you seen the way people wear masks?
That's different.
What? No, it's not different. No, it's not different because they shove them in their pockets.
They start picking their noses.
They shove them in their bags. They're full of germs anyway. Then they're putting them on the mouth.
That's different.
And then I'm sorry, they don't work. And the way they wear them, they're hanging off. They don't work. And I don't even believe
they do work. It's how people wear them, you're right. You can't say that face masks don't work. You can say that people don't wear them correctly.
I can say they don't work, and it's not me saying they don't work. It's groups of scientists who said they don't work.
Right.
Sage said
Let's
they don't work.
assume we don't have someone who's an idiot who leaves their mask hanging off one ear, or as we saw in the States, people were cutting holes in the middle so you could hear them speaking. Leave that to one side. Let's assume we're like Natalie. We wear our masks properly. We keep them on. We don't pick our noses. Whatever. So we've got to the point where we've got ill people in masks. And by the way, Natalie, this is just what they do every year in Singapore and Malaysia and Japan, right?
I know there's a lot of hesitation about masks because of all of the trauma that mask wearing caused during COVID. And again, it's a reminder this is not another lockdown. But yes, many cultures and countries use masks anyway, and it's not traumatic for them. No one enjoys wearing a mask. So let's just put enjoyment to a side. But also this is about protecting the wider population. It's about protecting those people who are vulnerable, who you may not be able to visibly see are vulnerable, the elderly, newborns. And it's just about trying to reduce the pressure on hospitals as well, because you may be well now and you may not catch the flu, but then you may get something else requiring a hospital admission and you'll be the one stuck in that very, very long wait.
Can I take a call? Sorry, Natalie, forgive me, just one sec. Amy in Carlisle, hello.
Hello, Jeremy.
What about this? We start by saying if you're ill, you must wear a mask.
No, I think it's COVID paranoia.
Right, because we wouldn't have done this back in the day.
No, nobody mentioned. Everyone's been ill since the dawn of time. Yeah. And nobody had mentioned masks until COVID.
And I agree with
Carol,
on a bad... Sorry, Amy, go on. I didn't interrupt.
There's so much science that proves that they don't actually work. I mean, you were just talking about the Asian countries. They're wearing them because of smog.
Smog?
No, smog is dirt. Smog.
Why do they wear them over here when they're on holiday then?
Because they're used to it.
Because they're paranoid. Dirty, sooty, horrible particles are bigger than viruses. Okay. Viruses get through masks. So I've got a chest infection. Yeah. I'm going down to visit my 75-year-old mum in Birmingham next week. And she's told me that if I'm still like this, I've tried to phone you over the last week or so and I had no voice. Oh. This is the first time I've had enough voice to speak to you.
Right.
But she told me I've got to wear a mask in the house if I'm still like this. Now, before COVID, she would never have suggested that.
That's a very interesting example because in a way, you like that, Carol.
That would be the one thing that I would agree with a mask because the people who die of flu in the winter are generally the elderly. And I think if you're going anywhere near an elderly person and you've got anything...
Well, you now think masks work?
No, I don't think they work.
But why are you saying she should wear one?
They work because it makes the was it your mum you're going to visit?
Yes.
Makes your mum feel better, so do it.
But it's just, hang on, it does cover Amy's face. I mean, I'm funnily enough, I think...
What side are you on?
Well, I'm never honest. That's how it works around here. Radzi.
My caveat is that masks should be worn in hospitals and doctors' surgeries, yes, and I do think that's absolutely important. Yeah. But I would also say that I think this is also as a direct result of politicians' failure throughout lockdown, that now, when we're told to do something, we have incredible amounts of suspicion. But my other final point would be that flu deaths result in is 3% of the annual deaths in the UK. If we were going to go down this route, then we'd have to look at the biggest killers, Alzheimer's, dementia, heart disease, respiratory, and then we'd have to say, well, hang on, we have to mandate what you eat, we have to mandate exercise, but that's where this is going.
Yeah, okay, but this is the easy one. It's quite easy not to catch the flu.
Can I ask a question? Natalie, do you agree with schools being closed and children being sent home because of this flu virus?
So I don't agree with schools being closed because I think that's very important for children to go to. But if children are unwell, they should be off school, and not just for public health, but also for children. Their recovery is actually better when they are rested rather than if they are at school. So they should certainly be at home and recovering if they are unwell. I do agree with that.
Weirdly, and we will come to this, our next item is about, is it right to encourage pupils or incentivize attendance with free gifts. You've got to say, there's got to be wrong now. If you're trying to say, come into school even when you're ill and you get a TV. This is great. But anyway, it's a different story. Wendy in Berkshire, hi.
Hi, Jeremy.
Hi.
I phoned you during COVID.
Of course.
I worked in Sainsbury's and I wore a mask because I have asthma and I was worried. I got chest infections for a year. I never got a chest infection or a cold all through COVID.
Well, Carol, you've got a bit of asthma.
Actually, Wendy, I'm on the verge of an asthma attack as we speak.
Are you okay? So we're going to watch it. So you don't have to worry. If you want to have one, you can have one.
If I want to have one, I don't want to have it. No,
but I just don't want you to be. So Carol's coughing is an asthma thing, and so Wendy relates to this.
It may well be, Wendy. What, darling?
I do feel that if you're going into shops, put a mask on. Coming out of shops, take the mask off.
Into shops.
I'm not doing it.
Well, the trouble is, what the downside of masks we now know, which is that toddlers probably have fear for the rest of their lives. Everyone looks like a bank robber. You can't read anyone's facial expression.
But what happens if you're deaf, for example?
If you're deaf, exactly, and you can't hear someone saying, watch out for that car.
May I just say one more thing?
Yes, Natalie, please do. I'm so sorry.
I hear you. There have been problems with social interaction, with language development, all of that. But right now, what I would urge everyone to think of, and what I see as a GP in primary care, is that your health is your greatest privilege. So while you might be sitting at home thinking, I'm fine, I'm not going to get affected, I don't care about anyone else, it's because you're well enough to feel that way, but some people don't have that privilege. And so I just want you to think about them, please.
Yeah.
Well said.
Well, Carol, are you thinking about them?
If I thought masks worked, I would wear them. I don't think they work.
Right.
What about the flu jab, by the way?
Well,
exactly.
Okay, let's just get some info from Natalie, because this is a good moment. Leave aside the debate here, Natalie. Number one, we've all been jabbed up, but is that jab now out of date?
Not necessarily. So the flu vaccine is an excellent way to try and reduce transmission as well. And we are completely urging people to come forward if they haven't already, because despite this being a mutation of the virus, there has still been evidence to show that it still can reduce the transmission and the sort of severity of illness in people that have had the vaccine. So that includes children. So your 2 to 3 year olds, your school children, your over 65s are all eligible, and your pregnant women and vulnerable patients within that age range are also eligible. So please do come forward. There has been evidence to show that despite the variant, despite this super flu, as we're calling it, H3N2, it does help to improve symptoms. Now, common misconception is that you can catch the flu after getting the vaccine. Not true. It can take up to 14 days to actually develop the immunity against flu, but within that time frame, you can still catch it. So you could have caught it before the vaccine. You can catch it after the vaccine for up to 2 weeks, which is when the immunity starts to kick in. So I would still recommend the vaccine. Maybe you can get the vaccine if you haven't already done. And also wear masks.
Okay, thank you. Well done for slipping that in at the end. It's too late for Carol to respond. Natalie, you're such a star. Thank you so much for joining us in our little happy show here. Later, it's the papers and everything else. Find out why a new McDonald's ad is being criticised as creepy. After the break, though, is a school in Manchester right to give out TVs, bikes and gift cards to kids for turning up at school, just for turning up. 0207 862 2222 is the number you need. See you shortly.